If you're looking for ways to reduce your breast cancer risks, you're seeking to resolve any breast imbalances, or ultimately optimize your breast health, today I'm going to share with you 5 really impactful ways to lower your breast cancer risks. This video kicks off Breast Cancer Awareness Month, and I'm really excited to share with you a freebie as well that's going to benefit your breast health. Let's dig into today's video. Welcome to Breast Health Awareness. Honestly, I don't celebrate a month here at Natural Health Resources. We celebrate every day, every week, every month in helping patients promote their health and wellness, especially when it comes to lowering breast cancer risk factors. Today I want to share with you 5 really powerful ways for you to lower your breast cancer risks. And I have a free download, so make sure you comment on today's video, ask me any questions, comment about any tips here provided, any of your thoughts. I welcome your communication because we're giving away an amazing resource that will actually help promote your breast tissue. So let's dig into today's video. Tip number 1. Ultimately, one of the best ways for you to reduce your risk factors with breast cancer is to balance your hormones. So particularly, there are 2 hormones that need to be balanced, and this balance is a 3-to-1 ratio of 3 estrogens to 1 progesterone. So testing your hormones on an annual basis and sometimes every 6 months is going to be critical for you to evaluate your levels and to get on any types of changes or imbalances that might spike because of thyroid imbalance or factors influenced by the stress hormone cortisol, as well as even medication influences. Balancing estrogen and progesterone are absolutely critical. And if you're looking for more ways to do that, I have a whole bunch of video content here on YouTube. I'll post links down below, as well as blog articles over on my website. So make sure to peruse the description box for all the links in today's video. Number 2, it's really important that you address breast density. Breast density can range from a buildup of fibrotic tissue. It can also be from a buildup in glandular tissue that is influenced by hormonal imbalance. Fibrosis or fibrotic tissue can be influenced by your underwire bras or tight-fitting clothing. It can also be influenced by hormones, as well as things like caffeine and alcohol, and even thyroid imbalances. My favorite and free resource for you this month is to address breast density by doing, on a weekly basis, a breast mask. This is a detox mask that is really powerful at driving in nutrition into the breast cells. It also helps to promote cell apoptosis, the transition of some of the breast cell irregularity. And if you're looking for some other impactful ways to promote the turnover of breast density, I have 2 articles that are great on my blog. I'll include those down below. Tip number 3, daily, weekly, and monthly self-exams, and to have the assorted annual screenings that are necessary for your breast health profile. And the latter I'll explain a little bit more, but most importantly, I've seen on some of the socials and even with fellow YouTubers, people talk about like the first of the month is when you want to do a breast exam. Well, no, that's actually not accurate. Every day you want to be aware of breast tissue changes, and the state of density of your breast tissue. One of the things that's really important to note, ladies, is that through the month, your breast cells change. The density changes, the feeling, and even the size, the weight of your breast changes. So if you just choose like one arbitrary day to do a self-exam, or even an arbitrary day to do a screen, so that might not be the best, most accurate and convenient way to analyze and optimize the screening tools to your advantage to lower your risk factors. So if you're curious about the assorted breast screening tools that you can use and what I recommend, what I personally use, because I'm a mid-40-year-old woman, I'm going to share with you a few of them here. But make sure you hit that subscribe button. In 2 weeks from today, I am going to share with you some of the most powerful, impactful, latest, and very influential tests and screens that can actually help minimize those risk factors. So that video will be extremely in-depth. But depending on the state of your breast tissue, depending on the density, depending on if you've breastfed or had surgeries, and depending on if you have familial predisposition to breast cancer, then certain screenings may be more appropriate than others. For instance, I recommend that all women undergo a thermography, a thermogram of their breast tissue. You can start as early as your late teens and early 20s, getting a baseline. And then once you do a thermography or thermal scan of your breast tissue, you have a repeat so we get a total baseline. Ideally, with any screenings, I like to recommend, if you are menstruating, that you go on day 5 to day 10. That's actually the best breast time to get a screening. You're gonna have less density, greater clarity for the assorted screens, especially for those with higher density scores or fibrocystic breast syndrome. Thermography, while it's not FDA approved, is very powerful at addressing cellular changes 8 to 10 years before they develop into precancerous and cancerous cellular tissue. You can do a thermography session over your whole entire body. You can get specific targeting organs and glands, but with an annual routine of doing a thermography, that's a good way to pick up any cellular changes so you're more proactive and can deploy a lot of the recommendations and tips that I share with my patients and folks here on YouTube. Now, the other thing that I recommend is a much more advanced, less human error involved 3D automated whole breast ultrasound. This is a newer technology. It's called SonoCine. I'll include some links where you can find potentially some locations near you. It is still really new and in the infancy of this particular diagnostic tool growing and being accessible. This is very powerful because of a few reasons. One, the screening tool of a 3D automated ultrasound will take over 300 images of your breast tissue. One of the things, if you've ever had an ultrasound of any part of your body, but particularly your breast, for any assortment of reasons, you know that there's a human tech that's guiding the ultrasound wand, and it's very subjective. And that can be problematic because often the order is not going to say the quadrant or location of the mass or cyst or trouble spot. So you as a patient have to communicate that. So, there's some inherent difficulty there sometimes of really being able to convey and highlight like all the areas needed to be assessed. Often when you have an ultrasound, they're not going to scan the whole entirety of your breast tissue. And breast tissue is going to be from the clavicle well below the breast to the midline and then all the way over past and including the armpit and down the side here of the breast. So ultrasounds can miss human-based guided, non-automated ultrasounds can miss a lot of potential suspect tissue. One of the things that we're seeing with SonoCine is they can identify 2 to 3 millimeter size changes and lesions. Women are catching breast cancer earlier and they're getting better diagnostics from that type of machine. So that is definitely one recommendation. The second recommendation is to use mammograms in a way that's beneficial for you. I know there's a lot of people who don't want to do mammograms. I get it. The radiation exposure, I get it. If you have denser breast tissue or a familial history, sometimes that is necessary. And so the two, a human-guided ultrasound and a 3D mammography will go hand in hand. Now, in many cases, the screens are just mammography. Regardless, choosing a 3D mammogram is going to be better than the 2D mammogram. It's kind of the top or bottom or side view. The 3D actually scans from a view of looking inside, kind of at an angle, and is a much more comprehensive view, especially for denser breast tissue. So in the event that you don't have denser breast tissue or don't have a familial history, you can pick and choose. And that is something that as a patient, you have the freedom and the capacity to do that. So let me know down below which of these, if any, have you tried? What are your thoughts? I welcome that communication. Number 4 is to support your liver. Your liver is a really critical organ and gland, so it serves both a function. It's filtering our blood, it's helping detox our body, but it's also metabolizing out excess estrogens, which can be toxic to the breast tissue. It's also synthesizing hormones and compounds like vitamin D, as well as assorted thyroid hormones like T3 and T4, and the reverse of T3. One of the most tragic stats for breast cancer patients is that 40% are in a chronic constipated state. If you support your liver, you're going to eliminate your constipative state, because by promoting liver health, like taking dandelion and milk thistle, and I'll provide some links down below, you actually help promote bile production and you get your liver engaged so that it can move the bowels. So eliminating constipation is a huge preventative tool, but it's also supporting the liver. That's going to have a deeper hormonal balancing that ultimately will positively affect your breast tissue, particularly the thyroid hormones, which that leads me to my last and final tip, which is to measure your iodine levels. You can take a urine test. This is a urinalysis that we do. We have kits that we send to patients. They can do in the comfort of their own home. So this tool uses urine that's collected on this paper to evaluate your iodine levels. One of the most powerful ways to prevent breast cancer is to make sure you have optimal, not normal and definitely not subpar, optimized iodine levels, because iodine receptivity in the breast tissue is great, and iodine can help minimize the cellular development of breast cancer, as well as an assortment of other diseases and disorders and cancers within the body. But measuring your iodine allows you to be really specific. You might want to add an iodoral or Lugol, so liquid iodine. There's an assortment of resources of iodine, from consuming kelp to adding kelp flakes into your daily diet. Most importantly, if you are taking iodine, you want to measure it. You don't want to go beyond optimal levels, and you don't want to under supplement. So that becomes really critical, that you consistently evaluate your iodine levels. And these are really easy to do. If your providers won't test for you, I'll include a specific test link down below. We have a combo where it tests iodine and creatinine levels. So it's really important for you to evaluate where your iodine is, because optimizing it can literally change the state of your breast tissue. And in fact, what they often see is individuals that have iodine deficiency have greater propensity to not just breast cancer cell development, but also fibroids and cysts that develop, causing painful, swollen, and inflamed breast tissue. So I am really excited to share these 5 tips with you. I want to encourage you to comment down below. Ask me any breast health questions that you have. I will be using your questions in future video content, as well as answering them directly as this month goes by. I'll be answering them on our blog as well and our socials. As promised, my bonus gift to you to help promote your breast tissue is my free breast mask. This is usually a paid digital product, but for the month of October and promoting breast health awareness, I am offering this as a free guide. So the link to download your free breast mask is down below. So make sure you opt in, because there's going to be a whole bunch of other savings and specialized discounts for folks who are in my email community. So you'll not want to miss a lot of those assorted resources that I'm going to further educate in emails throughout the month. Now also, if you are looking for more in-depth breast health support, I'm going to recommend that you check out my extensive breast health course. This is a guide to optimal breast health. This course covers an assortment of modules. I dig into Breast 101 and detail a lot of clinical research. We delve deeper into genetic testing and really specific resources and protocols, downloads, video tutorials, a whole arsenal of breast care, breast health, promotive, educational resources. So if you or any loved one is dealing with a cyst, a fibroid, a mass, a lesion, suspect tissue, or going through the phases of breast cancer and recovery as a thriver, this course is a must and will be extremely impactful, especially those who are entering the early phase of any type of breast cancer journey. I cover a lot of tests and diagnostics, labs that might not be fully discussed or even recommended for an assortment of reasons, but I give you a lot of access to information so that you are more empowered as a patient. Ultimately, this breast course covers all categories of women from the early teens all the way into their 90s and 100s. So the link for the course will be included also in the assortment of links down below in the description box. And I'm so excited to share this information with you. And every Saturday here in October, I'll be releasing a breast health educational video for your viewing pleasure. Thank you. Have a great day.